diet medications out there.
Absolutely. In recent times, the FDA has approved 3 medicines to be used for long-term use. That would be Contrave, Belviq, and Qsymia. Previously, we were using a short-acting amphetamine, and the FDA had that approved for very short-term use. 2 weeks is about what you should be using it for.
And that's really not long enough to lose weight.
It's not long enough to lose weight, and it really didn't work. And it had some interesting side effects with rapid heart rate, inability to fall asleep, and it came in other preparations that ended up being harmful, like the old Fen-Phen that everybody remembers. But the newer ones work in different ways, and all 3 of these medicines have a different mechanism of action, and you should talk to your doctor before deciding which one of those medicines would be best for you, if any of them.
Well, and that's true. And before you even consider a medicine, it's still diet and exercise is the main ways to use.
Oh, absolutely, diet and exercise. And if you do decide to go the medication route, that does not mean stop dieting and stop exercising. These are adjuncts to diet and exercise.
And there's different side effect profiles that you have to pay attention to, as well as the cost of the medicines, pretty steep.
It is, and Qsymia, being one that has an amphetamine in it and has topiramate, which is a headache medicine, will have a different side effect profile and a different cost than, say, the Belviq, which is a serotonin medicine.
So not only medicine and diet and exercise, but at some point in time you may want to consider a surgery.
Yes, right now surgery is your best option for losing weight long term and keeping it off long term.
All right. Well, we're going to go to Baptist Health Lexington, their Health Talks, and have them tell us about weight loss surgery.
The vast majority of people, I think the main issue when they finally come to weight loss surgery is their quality of life is poor. Unfortunately, your life expectancy is cut about 15 to 20 years if you're morbidly obese.
In high school, I had gained so much weight that I had to quit marching band, and I was unable to do so many activities that all of my other friends were able to do.
Here at Baptist Health Lexington, we offer a comprehensive weight loss surgery program. There's been a lot of changes to weight loss surgery in the last several years. The technique I use mostly is for a procedure called the laparoscopic sleeve gastrectomy. And I do that through a laparoscope, which is a small video camera or a robotic. And what I'm able to do through that in about an hour and a half is remove the outer portion of your stomach, turning your stomach from about 1.5 liter bag to a banana-sized tube that holds 1/10 the size of what your stomach used to hold. It's not uncommon to lose 30 to 50 pounds in the first month, depending on where you start, and be down to over 100 pounds by 6 months.
I went from a size 24 that I was squeezing into, and I now wear size 4s, and I sometimes cannot believe that I wear size 4.